Well, hello everybody, and thank you so much for joining us today for our webinar, iPad at the Bedside at Geisinger. Today is part one in a three-part series that we've been putting together over the last week or so, where we'll be digging into customer stories around different Apple-based mobility initiatives in healthcare. My name is Adam Mahmood. I'm the industry lead of healthcare here at Jamf, and I'm joined today by a very special guest, James Rafel, Program Director of Hospital Systems at Geisinger. A brief look at our agenda for the day. We'll start with a little overview of Jamf in healthcare, followed by a look at iOS and tvOS solutions for patients, and then spend the majority of our time digging into Geisinger's story. We'll, of course, leave a little time for question and answer at the end. Now, if you weren't familiar, last week we got the news that HIMSS 2020 in Orlando, which was set to happen this week, was canceled. This was the first time in nearly 60 years that the conference was not going on, shaking up much of the health IT world. Jamf wanted to keep our momentum and activities that we had planned for the conference, but bring them to you digitally, hence today's webinar. If you're interested to learn more about the other activities we have going on, both additional webinars as well as one-to-one WebEx meetings, feel free to head over to jamf.it/HIMSS. Now at HIMSS, we had 3 different customer stories planned to take place in our booth, each one of them focusing on different initiatives in healthcare that both Jamf and Apple are focused on. Today's story is digging into patient experience and all the ways that iOS devices can transform it. Now, if you're new to Jamf, we help organizations succeed with Apple. It's a mission we've been on for nearly 17 years and one we're committed to over the future. The majority of that time, we've been providing mobile device management solutions, or MDM for short, for the entire Apple ecosystem. Whether an organization is deploying Mac or iPad or iPhone or Apple TV, we can help. But we've really doubled down our commitment to Apple over the last year and expanded a whole product portfolio around different authentication and endpoint security solutions for the Mac. Expanded out our mobile device management suites to 3 distinct offerings depending on the market. And of course, this is all backed by nearly 100,000 users as part of our community, Jamf Nation. Today, we'll really be digging into Jamf Pro. This is the gold standard for Apple device management and how it's powering certain use cases in healthcare. Now, speaking of healthcare, we have leading organizations using our products today. This includes the top 8 of top 10 children's hospitals, as well as the top 15 of 20 U.S. adult hospitals. And the reason they're using Jamf is pretty simple. With Jamf Pro, we're able to simply and easily secure our devices, ensure they have the right settings, monitor the health of those settings remotely, and take action when those settings are out of compliance. For users, we can ensure that devices are standardized with the right set of resources that they need. And when you really take together the platform, the ecosystem, and all that it entails, we can unlock some unique experiences, in this case, for patients. Now, at the heart of this concept for Jamf is an iPad in the hands of the patient throughout their stay. And that iPad being loaded up with all different types of resources that can help that patient better understand their conditions, their procedures, their goals prior to discharge, and much, much more. So just a brief look at the workflow, and I promise I won't steal too much of the thunder, since James from Geisinger will tell you more about it in a bit. But a lot of this comes back to how we can create a fresh experience for a patient each day. When they're admitted, how can we ensure that it's an easy setup of an iPad that very much feels like it's fresh out of the box from Apple? So the patient is confident that it's clean and doesn't have anyone else's footprint but their own. Here you can see Jamf Pro working in concert with some of Apple's programs to configure this iPad over the air in a matter of minutes. And once it's configured, how do we make sure it is dead simple to undo all of this? At the heart of this workflow is a solution that Jamf has built for this problem called Jamf Healthcare Listener. When a patient is discharged in the medical record system, That's it. There's no extra work because Jamf Healthcare Listener hears that command and automatically transfers it to something Jamf Pro can act upon. So more specifically, what we're talking about is an MDM to EMR integration. Jamf Healthcare Listener translates a discharge or a transfer from your EMR into a remote wipe command from Jamf Pro. This brings this over-the-air automation to deploying iPad and Apple TV at scale. Now, that's a brief look at the tech, but what I want to do is turn it over to James, because it's a whole different story to understand how does this technology apply within an organization and help them reach their goals around mobility. So with that, James?
Thanks, Adam. So I'm James Rafel. I'm a program director at Geisinger and have been here for 20 plus years in a variety of roles. And my current role is on the hospital systems team. And one of our primary projects that my team supports is our interactive patient system that provides iPads at the bedside. The why of what we do is exactly what we see on the screen here. Our patients, our providers, nurses, all ages of patients are impacted by this specific system and a couple of other patient experience programs that I'll touch on in a bit. So Geisinger, we have committed to, as you can see, a fair number of mobile devices. In this case, what we're going to be talking about today are the two kind of the 1450 BYOD iOS devices and the 4400 iPads. Now, those blocks are colored a little differently because we're going to be talking about a subset of each of those areas with what we do at the bedside. So if we can go to the next slide, there we go. And again, why? The words that you see in there, the transparency of care, the healing, the patient engagement, all center around what kind of experience can Geisinger provide for our patients while they are in the hospital, over and above the actual healing process. So we'll go back a ways a little bit here to the first generation iPhone in 2007, the first generation iPad in 2010. As you can see, a little bit later in 2011, we started looking at what these devices could do in the enterprise. And it wasn't until 2014 that we have kind of started on this journey. So the requisite IT nerdy slide I will put in. We have our Dr. McCoy here with his standard tagline that we're a hospital, not an IT shop. And in 2014, we, on my team, were presented with a paradigm shift where looking at patient experience became a driving force for the project that we were given with something at the bedside. At that time, the something wasn't really determined, and it was up to us to sift through all the different tech that was available at that point in time. So at that point in time, this is obviously a Jamf webinar. However, any MDM will do in this case, but it's the plus afterwards that's the important part. Obviously, Jamf is important. I won't discount the partnership that we have had with them, and it has been very fruitful. Eventually, as we get to further on in the slide deck, you'll see just how far we've come. So the plus part, it's not just about the MDM. It's about a variety of other pieces that have allowed us to provide the patient experience that we do at the bedside. So starting out with what we had back in 2014, Apple's products were key. The DEP piece and the VPP piece have now evolved into Apple Business Manager. But they allowed for multiple potential configurations to ask any of the startup questions. As you saw in Adam's introduction, the iPad that he demonstrated showed 3 questions: the language, the location, and the wireless network, and away you went. That we looked at customizing any of those questions and came up with our solution. The VPP, or Volume Purchase Program, allowed Geisinger to essentially provide an app store with 110 plus applications to our patients without the need for a login or any kind of personalization on their part. Square peg in a round hole. We looked at the possibility that anything could be done, from a completely locked down single purpose iPad to completely open to allow people to put in their own Apple IDs, install whatever they wanted, to give them, the patients, the best experience they could get. Workflows, yes, tech isn't always the answer. So we had to figure out the partnerships, working with the operational staff on how to get the iPads to the patients, how to clean them. As Adam alluded to, one of the Jamf products that became available after a few years to us, the healthcare listener, took care of some of the hurdles that we had, and I'll touch on that in a couple of minutes. So patient experience at Geisinger has, over the past 5 years, become even more emphasized as we try to differentiate essentially the availability of resources to patients beyond just their healthcare. So in my area, for our team and what we support, I'll touch on these 4 programs real quick here. 3 of them real quick, one of them a little more in depth. So Classroom Connect is a project that allows kids who are school age that might be here at Geisinger for an extended period of time or on a repetitive basis where they could be out of school more than their friends. This project allows them to stay connected with their class, with their teachers, with their friends at school. On the screen there is an article that we had put up on our website last year, actually 2 years ago now, that kind of goes over the details of this program. But the bottom line is, without an iPad at the bedside in our children's hospital, this program would not have been possible. So again, if you go out to the geisinger.org website, you can see more of the details about that program. And there's a second shot of one of our patients who is interacting with her friends at her school during the school day when she was unfortunately admitted to the hospital here. Second item, language interpretive services. As part of the Affordable Care Act, it became a mandate that organizations provide interpretive services to their patients versus requiring the patients to bring an interpreter with them. So because of that, we started a major push to provide devices with a specific interpretive service application on them to our patients. And in those cases, we are using device or application-specific devices as opposed to the actual bedside iPads, but those devices are available at the bedside as needed and shared amongst units or different clinics. Those devices are managed using Jamf, and it has, I would say, made the deployment and the upkeep of them much better than when we first deployed them without an MDM. So again, in that case, I'm happy to talk more about that. But if we can move on, I'd like to still focus on the next couple of items here. Telemedicine. So goal is to provide the right care in the right place at the right time. These images show iOS specific devices, whether they're iPads, iPods, or iPhones. The mobility in telemedicine has exploded over the past couple of years. As a result, we are using our iPads at the bedside for physician consults, for remote consults, and don't change the screen just yet, but I will touch on one of our pretty neat programs in a second. What I do want to mention with regard to telemedicine is the ability to utilize peripherals. So the one square there on the screen where you see what looks like an otoscope or a tongue depressor. The technology has advanced at a very rapid rate in the past year or two. And as a result of that, we on the IT side have had to keep up with it. Having an MDM in place has made that so much easier to be able to flex and be agile. And I will definitely touch on that aspect in a second. So if you can go to the next slide. This is a program that we implemented a few years ago where a mother who gives birth to a preemie type of child or somebody that needs to end up in the NICU, they may be separated. So they may give birth at one of our hub sites, and then the baby needs to be transported to a NICU at another site. This program was developed by our NICU folks, and it allows the mom to connect and bond with the baby while they are separated. The bonding piece is an integral part of the mother and baby experience early on, from the first minute out of the womb and from there forward. For those that have had NICU babies, I'm one of them. This is such a great tool that's available today that wasn't available 10 years ago. And we're pretty excited and proud of this piece of our telemedicine. So for the bulk of the rest of what I'm going to be talking about is our interactive patient system. And as I touched on at the beginning, it started in 2014 with a thought that we wanted to provide a better patient experience, to engage, inform, and stay connected, as well as entertaining. You may not think entertaining in the hospital is an important thing, but anything to take a patient's mind off of why they're here is invaluable. So the asterisk there at the bottom, at the time in 2014 and kind of through today, is we're always having to use brand new tech. In some cases on a TV, have to have perfect data security. Infection control procedures are paramount in a hospital. And last but certainly not least, the clinical staff buy-in to whatever we do, because without them, the technology does not connect with the patient. So a couple of pictures that we'll see during this discussion are just going to be some examples of what we do. here with our iPads. In this case, our pediatric patients have the ability to take the iPads with them to treatment, or if they're getting a cast removed, or if they have to have an IV done. Distraction with the iPads is a key tool that our child life specialists use to help them through the process. In addition, in some cases, our specialists will show them a procedure on the iPad prior to it being done so that they can feel comfortable and not be surprised. This image, and I believe the next one, will be just a picture of the iPad in the patient hand. And if you switch to the next one, the patient is able to use an application here at Geisinger that ties directly to our EHR to let them see things like their lab results, where they might be in their schedule if they have a radiology appointment while they're here as an inpatient, the ability to take notes, message their physician through an outside application. Also find out who's taking care of me is a important feature to allow a patient to see the actual picture of the nurse and a name, so that as the myriad of people coming in and out of their room continues during their stay, they might be able to start to connect the names with the faces. That seems to be a valued feature of this product. In addition to this application, there are some other clinical applications and clinical education that's used to allow the patients to become more engaged in their healthcare. And when a patient is more engaged, there's more buy-in, there's more commitment to keeping up with either the aftercare or the care while they are still admitted. So as I mentioned before, the iPads that we keep at the bedside, using Jamf, using a wide variety of the features available in Jamf, from configuration profiles to smart groups, static groups, pushing web clips, pushing some iBook connections, in addition to just publishing the 100+ applications that are selected either by our staff or through feedback that we get from patients. Things as simple as a crossword puzzle app, or an old word find type of application that folks would like to use. We can quickly deploy those. One quick patient story that we kind of take pride in is on one of our floors, a patient had a trach in and was not able to speak. And we were quickly able to locate an application, a text-to-speech application, that we could deploy to their iPad and allow them to, quote, speak to the staff and their family. And that little bit of caring went a long way. The feedback that we got from the patient and the family just made their stay a little bit better in a not so great situation. So some of the requirements that we had to look at the time, and even now, network friendly. So streaming things like Netflix, for example, or music, or even playing some of the newer games like a Mario Kart. They can be network intensive, and as we've now deployed over 400 iPads throughout the system, we want to make sure that we cooperate with our network folks. Management friendly, I've already touched on the tool, the Jamf tool itself, and how invaluable it has been. And cost friendly in any project that we do, especially in healthcare, there needs to be a return on investment to make sure that we're spending our money wisely. In a case like the interactive patient system, there's it's not as easy to quantify an actual cost and how that cost is recouped. But at the forefront of our project management was making sure that we are not spending money unwisely. And with the iPads, and in some cases, Apple TVs, as well as the management infrastructure, I think we've done a pretty good job with that. Additionally, scalable. Scalable, low maintenance, and a small footprint. So scalable, when we first started this project 5 years ago, it was going to be done at one of our hospitals. We have 8, as well as outpatient surgery and clinic sites. So at the time, it needed to be scalable for the one building. As of today, we now have it installed in some part or fully at all of our hospitals, as well as outpatient surgery sites and urgent care sites and things that were not even developed when the project started. So the scalability of this project, again, I guess I am harping a little bit on the fact that the Jamf product has been super helpful with this. It has. It's allowed the scalability. The low maintenance and the small footprint, those were clinical requirements. Our nursing staff needs to do nurse responsibilities. They don't need to be iPad pushers. They don't need to be fixers of an app or figuring out why the iPad's not working. So they needed to be as simple as possible with the ability to wipe them and start fresh. So at the beginning of this, and I will touch on, actually, let me see if the next slide touches on it. There we go. So we've kind of gone through now 4 iterations of this project. At the beginning, with the tech allowed us to install a Mac Mini on the nurse's station, so a small footprint, plug the iPad into it, and refresh it that way. As it says there, a monolithic image, no DEP. It took about 40 minutes to reload an iPad. And while it did provide some good things for the patients, the staff were not super enamored of it because it required them to put the iPad back in the room, wait for it to reload. It just wasn't ideal. So as time went on, we got to start to work with DEP. We got to start to work with a dynamic image as well as caching servers. And the manual reload was still there, but we were able to reduce the time to about 4 minutes. Now, fast forward to Healthcare Listener. We are now automatically reloading these iPads through no touch of the staff. The maintenance falls to my team to learn some HL7 interface language, to work with a couple of different integration teams, which has been very successful. And we can watch now as hundreds of iPads turn themselves over in our inpatient settings on a weekly basis, which is fantastic because, knock on wood, it's pretty much bulletproof. Even if the iPad is not connected to the network at the time the command is sent, once it reconnects, that command that tells it to erase over the air happens, and we are pretty much guaranteed no patient information, no patient data will be available to the next person in the room. And what I didn't put on there, we are what I would say up to version 4 now, because we now have the healthcare listener piece in place. It's now allowing us to focus our time and effort on more development of more uses of these iPads. So what's next? This was a text that I received from one of the gentlemen on my team when he was out rounding. So more time available to our staff allows us to round on the floors and make sure that the iPads are being used, get feedback potentially from patients, as I said about the apps and what they're interested possibly. Get feedback from them on what other things could be missing from the iPad. So the rounding, while his name is Chad, as you can see there, while Chad was out there, it allowed him to observe one of our iPads being given to a pediatric patient who was waiting for a same-day surgery appointment. And as you can see, the little boy got the iPad. The parents, the stress levels went down because they were distracted with the iPad while the prep was going on. And then the second block there shows kind of an interesting development that was observed in that the surgeon could connect at a different level besides the medical with the patient that was waiting and just asked about the game that he was playing. So something else that it's kind of an unforeseen benefit of this kind of tech available at the bedside. And touching on why we're doing this webinar, as Adam said at the beginning, we are not at HIMSS. So on the next slide, you can see that is that's an image of the thing that is causing all of the angst at this point in the world with coronavirus. And one of the good side effects that we have found with this program is the increased agility that we have now to flex or deploy something different through the iPads that we have at the bedside or the mobility options, as the first slide in the deck showed, the 11,000 devices, mobile devices that we have here at Geisinger. We last week were able to put in place very quickly a variety of devices, mainly iPads, that potentially would allow communication either patient to family or patient to provider in an isolation situation. So luckily, we do not have any patients at this point that have had to be isolated because of this. But on the off chance that we will, we now have these devices that we can deploy either our clinical applications to allow telemedicine encounters to happen, whether it's because a provider is under the weather and they don't want to come into the hospital, and they can do the encounters from their location into the hospital, or if they're at the hospital and don't want to go into the room, we can provide that kind of connectivity into the room itself. And then the flip side of that, if the family members are in some cases quarantined at home and they can't get into the hospital, these iPads can be used either with FaceTime, with WhatsApp, with Facebook. Any of these audio video connections can be used on these devices to allow that communication to happen so that the patient doesn't feel as isolated, so that they still have that connection to the outside world. So this agility, I can see, version 4 of what we call the interactive patient system is going to allow us from an IT standpoint to flex with whatever is thrown our way. So that's my presentation. That's what we've done with our iPads over the past 5 years, and looking forward, as I said, that agility, that flexibility, I think those are the next things that we're going to be addressing, which could be anything. And we look forward to that because for those that have been in IT for a while, you know that your day-to-day routine, whether you're a network person, whether you're a end user computing type of person or application support or anything, your day-to-day work, a lot of times you don't get to see the fruits of your labor. And in this case, we're able to share all of this with the folks that have contributed to the project over the years. And it helps get them through the day to see that smiling face, let's say from the pediatric patient, or the trach patient who couldn't talk, or the patient that couldn't move their neck. So seeing this information up on the TV was just an added comfort to them. So that's the good stuff that we get to see on the IT side.
It's such a cool story, James, and we really appreciate you joining us today to share it with everyone. In lieu of time, we'll skip Q&A, but if you do have direct questions for James, feel free to reach out to him via the contact information on the screen. There's also a channel on Mac Admin's Slack titled Jamf Healthcare, where we'd be happy to add you in to join the discussion. Beyond that, thanks for joining us. Head over to jamf.com/healthcare for more information on this and other offerings, and have a great rest of your day.